Okay.
Good evening, everybody. My name is Sarah Bryan. I am a labor and delivery nurse for 13 years. I just recently became the interim manager of the OB department and have been educating staff as well as patients for the last 13 years. Today, we are going to discuss postpartum hemorrhage and the effects that it has on maternal mortality. 7 to 10 women out of 100,000 deliveries die each year in the U.S. 27 out of 100,000 die in Oklahoma each year from maternal hemorrhage. Maternal hemorrhage is the third leading cause of death, with embolism and hypertension ahead of that. With proper education for postpartum hemorrhage, we can greatly decrease the number of deaths in Oklahoma, as well as increase the treatment. Can also help us decrease the number. Today we're going to talk about what is postpartum hemorrhage, early recognition of postpartum hemorrhage, and treatment. Postpartum hemorrhage is recognized as 500 cc's or more blood loss in a vaginal delivery. In a C-section, it is 1,000 cc's blood loss or more in a C-section. Often these numbers are misconstrued due to physicians and staff not calculating the blood loss appropriately. When that happens, you can also look at the H&H, the hematocrit. If it's a 10% drop in the original baseline, can also indicate maternal hemorrhage. Maternal hemorrhage does not just occur within the first several hours of delivery. It's over the first 24 hours. So it is very appropriate to count your pads, really watch that bleeding for that first 24 hours after delivery. Some causes of postpartum hemorrhage is retained placenta, lacerations on the cervix or the uterine wall, synuclein, instrumental deliveries such as using a vacuum or forceps delivery. Of course, with cesarean sections, you have a lot of arteries that are going to be in the way and can often get nicked during the procedure. Hypertension can also play an effect in the use of Pitocin during induction of labor. Using the Pitocin during the induction of labor can make your receptors a little bit sensitive to where when it's time to clamp down that uterus, it doesn't have that power to really get down and clamp to prevent your postpartum hemorrhage. Some early recognitions: you want to, like I said, educate your staff and your physicians on the proper estimate of blood loss. Really look at each pad, each lap that is available. Look at, a lot of times the sponges in the C-section room are often misdiagnosed for their capacity. They can hold up to 75 to 100 mils per lap. So you want to make sure you really watch those and watch how much irrigation you use during your C-sections. Also look for blood pressure loss or blood pressure decrease. Know what your baselines are in your patients. If you are having a significant loss in their blood pressure, along with dizziness, lightheadedness, pale skin, you might want to recheck your H&H sooner than the 8-hour period. 4 hours is a good indicator for rechecking your H&H. So treatments, you want to do some uterine tonic drugs such as Pitocin. You can also use Cytotec rectally to stop postpartum hemorrhage. And if they're already up in stirrups, it's going to be readily available to place pills in their rectum. I know a lot of patients are going to cringe at that, but when they are hemorrhaging, you want to do everything possible to stop that as quickly as possible. Also, the use of the Bockery, which I'm going to show you that device here in just a moment, and putting pressure on all the uterine vessels can help decrease postpartum hemorrhage. Good thing to have in your hospital is some protocols set in place to where all staff members, including lab, pharmacy, and even your house supervisors, know what to do in case of emergency when you have a postpartum hemorrhage. Where is your supplies? What are the protocols for giving blood, and so forth. In conclusion, working together with physicians on educating the staff and them as well on the proper diagnosis of postpartum hemorrhage for your EBL is essential for the estimated blood loss. having your supplies readily available like I talked about. This is our postpartum hemorrhage cart. Top drawer, you're going to see IV start kits. We've got large bore IVs that we're going to be starting. Sterile exam gloves. And it's convenient, that's red for hemorrhage. Next door, you got Foley catheter, you got fluids, and you got the Valkyrie. And this is going to be placed by the physician up into the uterus. I'm not going to open this because this is very, very expensive. Then you fill a balloon inside with about 300 cc's of sterile water or normal saline that's going to put pressure on all of the vessels to help prevent the blood loss. It also has a port on it where you can hook a catheter bag to it to collect all of your blood loss. Any questions? Like I said, with the help of physicians and training and doing proper protocols and even doing some drills, I think we can greatly decrease our postpartum hemorrhage here in our hospital. Thank you for your time.